Imagine waking up and your tongue is so swollen it fills your entire mouth. You can't chew. You can barely swallow. Your jaw juts so far forward that your upper and lower teeth don't meet. You can't bite an apple. You can't tear bread. Your legs are so weak from rickets that standing for more than 10 minutes causes shooting pain. You have seizures, the kind where you lose consciousness and wake up on the floor not knowing where you are. This was every single day for Charles II of Spain. He didn't choose this. His family chose it for him, across 10 generations. And nobody has ever described what his daily life actually felt like, until now. Every documentary you've seen about Charles II lists his conditions in Latin: mandibular prognathism, Macroglossia, Malocclusion. They sound like vocabulary words. Interesting, clinical, safe. But those Latin words aren't safe. They're screaming. And if you translate them, if you pull the clinical terms apart and ask what they actually felt like from the inside, what emerges isn't a history lesson. It's a horror story about a body that was broken before it was born. So let's get inside it. November 6th, 1661. The Royal Alcázar of Madrid. A baby is born to Philip IV of Spain and his wife, Mariana of Austria. Mariana is also Philip's niece. He married his own sister's daughter. The court takes one look at this infant, an enormous head on a body with limbs so thin and floppy, the royal physicians privately doubt he'll survive infancy, and they know something is wrong. He doesn't walk until he's nearly 4, doesn't speak intelligible words until closer to 5. He's still being breastfed at 5 or 6 years old, not out of indulgence, but because his mouth is so malformed that transitioning to solid food is a genuine medical emergency. That baby will grow up to rule a vast global empire, and he will do it from inside a body that fights him every waking second. Here's the thing about Charles's genetics that most videos get wrong. They show you a family tree and say, inbreeding, and move on. But in 2009, Gonzalo Alvarez and colleagues published a study in PLOS1 that traced the Habsburg dynasty across 16 generations and calculated the inbreeding coefficient for every single member. A normal child of unrelated parents scores 0. A child of first cousins scores 0.0625. A child of a brother and sister scores 0.250. Charles II scored 0.254. More inbred than the child of siblings. Not because of one bad marriage, but because of 10 generations of them. Uncle to niece, cousin to cousin, the same ancestors appearing on both sides of the family tree so many times that the tree stops being a tree and becomes a circle. Over a quarter of Charles's genome consisted of identical alleles inherited from the same ancestor through both parents. Every recessive mutation that a normal person carries harmlessly in a single copy, Charles carried 2 copies. And the mutations expressed. All of them, it seemed. All at once. Now forget the genetics. You don't need them anymore. You need to know what it felt like to live inside the body they built. Your jaw. Start there because it's where everything starts. Your lower mandible extends so far beyond your upper jaw that when you close your mouth, if you can call it closing, your bottom teeth sit a full centimeter ahead of your top teeth. They never touch. You have what modern orthodontists call a severe Class 3 malocclusion, and what the Habsburg dynasty called a birthright. Try to eat. You can't bite into anything, not an apple, not bread, not anything that requires your upper and lower incisors to meet and shear, which is essentially everything. The Marquis de Louville will later note that Charles's food had to be prepared in a specific way, cut into tiny fragments, often reduced to near liquid consistency. That's the polite version. The impolite version is this. Every meal of your life is an engineering problem that someone else has to solve. Food arrives pre-cut into fragments small enough to place on the back of your tongue. Bread is soaked in broth until it dissolves. Meat is pounded to paste. You tilt your head, position the morsel, and try to swallow it whole in a convulsive gulp that bypasses chewing entirely. Sometimes it takes 3 or 4 attempts. Sometimes you gag. A meal that takes a healthy person 15 minutes takes you an hour. And by the end, you've consumed a fraction of what your body needs, and you're exhausted from the effort. But the jaw isn't just about eating. Severe prognathism of this degree causes chronic pain in the temporomandibular joint, that hinge where your mandible meets your skull, a grinding, aching pressure that radiates up into the temples and down into the neck. Constant headaches. A clicking or popping sound every time the joint moves, every time you try to speak, every time you swallow. It's not sharp enough to scream about, dull, omnipresent, the kind of pain that doesn't announce itself so much as it becomes the wallpaper of your existence. You wake up with it, you go to sleep with it. You have never known a single moment without it. And then there's the tongue. Your tongue might be the worst part, because your tongue is the organ you're most constantly aware of. Macroglossia, the clinical term, means your tongue is enlarged to the point where it fills your oral cavity completely. It presses against the palate. It pushes past the teeth, or what passes for the space between them. You are perpetually aware that there is too much tissue in your mouth. Swallowing requires conscious effort. The tongue doesn't retract cleanly. It bunches, folds against itself, blocks its own path. Saliva pools because your lips can't fully close. The tongue physically prevents it. You drool. Not constantly, not dramatically, but enough that you learn to swallow frequently, to dab with a cloth, to keep your head at a certain angle. The papal nuncio noted it. Multiple French observers at the Spanish court noted it. Charles's mouth hung slightly open. His lower lip, pulled down by the jutting jaw, stayed perpetually wet. And speech. God, the speech. The tongue is the primary articulator of human language. It shapes vowels, produces consonants by touching the palate and the teeth and the alveolar ridge with surgical precision. When the tongue is too large, those precise movements blur. Consonants soften. Vowels collapse into each other. You sound like you're speaking with a mouthful of cotton. The French ambassador reported that Charles's utterances were nearly unintelligible. Courtiers. And this is the part that breaks something inside you. Courtiers developed a practiced art of nodding, interpreting, and never asking the king to repeat himself. Because to acknowledge that you couldn't understand your sovereign was a breach of protocol that bordered on treason. You know what you want to say. You have a thought, you form it, you push it out through this impossible mouth, and you watch people's eyes go polite and blank. Every time, for your entire life. Now the bones. Your skeleton is a source of constant low-grade pain, punctuated by episodes that make you cry out. The rickets-like disorder, likely connected to renal tubular acidosis, impairing calcium metabolism, softened your bones during development. They bowed under your own body weight. The long bones of your legs curve, your rib cage deformed, compressing your lungs. Your spine developed a forward hunch. Walking on rachitic legs isn't like walking on healthy ones. Each step sends a jarring, deep, skeletal ache through poorly mineralized bone. Not a muscle ache, something deeper. Something that feels like the bones themselves are bruised from the inside. Patients with osteomalacia, the adult equivalent, say it feels like their skeleton is made of chalk that might crumble. Standing for any extended period becomes excruciating. The Marquis de Villars observed that Charles could scarcely stand, and appeared to have no strength in his legs whatsoever. He needed attendants to hold him up under the arms. He was frequently carried. Court ceremonies that required the king to stand were either drastically shortened or conducted with Charles seated while every other person in the room remained on their feet. A reversal of protocol that silently announced his incapacity to everyone present. Then there are the seizures. And this is where the second-person narration stops being a literary device and becomes something closer to an assault. You're in the middle of your day. Maybe you're sitting for an audience. Maybe you're at dinner. And it starts, for many epilepsy patients, with an aura. A few seconds of warning. Some people smell burning rubber. Some see flashing lights. Some feel a wave of dread climbing up from the stomach. Then the tonic phase hits. Every muscle in your body contracts simultaneously. Your back arches. Your arms lock rigid. Your jaw clenches with enough force to crack teeth, or to bite clean through your own tongue, which in your case is already swollen and protruding and catastrophically vulnerable to exactly this. You stop breathing. Your respiratory muscles are locked. Then the clonic phase. Rhythmic, violent jerking of the limbs, the head, the torso. You are unconscious. You don't know your body is thrashing on the floor of the Royal Alcazar, while attendants rush to restrain you, and the court pretends not to see. You might lose control of your bladder. The seizure lasts 1 to 3 minutes. To everyone watching, it lasts forever. But here's the thing nobody talks about. The seizure itself isn't the worst part. The aftermath is. The post-tictal state. You regain consciousness slowly, over minutes, sometimes hours, and you don't know where you are. The post-tictal period brings confusion so profound that patients report not recognizing their own bedroom. You can't form sentences. You can't remember what day it is. There's a headache like a vice. Nausea, a crushing emotional flatness, like someone pulled the color out of the world. The fatigue is so deep, it feels like your muscles have been replaced with wet sand. For you, with baseline cognition already impaired, these post-tictal plunges are devastating. You fall into deeper confusion, and the climb back is slow, incomplete, frightening. And in 17th century Spain, every seizure is proof that the devil has his hands inside the king's body. Which brings us to the treatments. They called him El Hechizado, the bewitched, because the Spanish court couldn't accept that the royal bloodline itself was poisoned. That would indict the dynasty. So they concluded that Charles's afflictions must be the work of demonic forces. Sorcery. Witchcraft. The solution? Exorcisms. Formal, church-sanctioned exorcisms performed on the King of Spain. Picture it. You're already in pain, already confused, already exhausted from a seizure or a day of struggling to eat and stand and be understood. And now a priest is standing over you, shouting Latin incantations, pressing a crucifix to your forehead, commanding the devil to leave your body. The exorcisms were physically aggressive. They involved shouting, physical contact, prayers that went on for hours. You are told, in the most authoritative voice your civilization can produce, that the source of your suffering is evil inside you. Not your family's choices, not 10 generations of consanguineous marriages. You. Something is wrong with your soul. And if you just endure enough of these rituals, the demon will leave and you'll be well. The demon never leaves. The priests keep trying. You keep hurting. On top of the exorcisms, the standard medical treatments of the era, bloodletting that weakened a body already anemic and fragile, purging that worsened chronic gastrointestinal dysfunction, herbal concoctions that made everything worse. Every treatment added a new layer of suffering onto the suffering. The disease, then the cure that wasn't a cure, then the spiritual diagnosis that was a lie. Let's talk about the daily routine, because routine is where suffering becomes relentless. Morning. The gentlemen of the bedchamber wake you. They've been watching you all night. Someone always watches, because the fear of a nocturnal seizure, of you convulsing in your sleep and choking on that enormous tongue, is a real and constant anxiety. Waking is miserable. Chronic pituitary hormone deficiency, probable hypothyroidism, the metabolic strain of renal tubular acidosis. You never wake refreshed. Patients with combined pituitary deficiency describe mornings as the worst part. Bone-deep exhaustion that no amount of sleep resolves. A fog in the mind that takes hours to partially lift. Sitting up in bed requires a conscious act of will that healthy people perform without thinking. Dressing is done entirely by others. You can't dress yourself, not because of one disability, but because all of them together, muscle weakness, poor coordination, chronic pain, make the fine motor tasks of buttoning and lacing impossible. Hands on your body every morning, limbs maneuvered by other people's fingers, a torso that slumps without external support. Then meals. You already know what meals are like. Court duties come next. Audiences, counsels, the signing of documents. You participate. You sit, you listen, you sign what's placed before you. The French ambassador reported that your participation in council meetings was largely passive. Real governance was conducted by favorites, the Duke of Medinaceli, the Count of Oropesa. They made decisions and brought you the paperwork. But, and this is the part that guts me, you weren't profoundly intellectually disabled. Contemporary accounts suggest mild to moderate cognitive impairment. You had some understanding, some will, some preferences. You were aware enough to know that people managed you, aware enough to sense that conversations happened around you rather than with you, aware enough to feel the gap between what was expected and what you could deliver, not aware enough to bridge it. That frustration, the frustration of knowing you're not keeping up, but not being able to articulate why, is one of the cruelest forms of cognitive disability. It's not blissful ignorance. It's partial awareness, just enough to suffer. Then came the decline. By his late 20s, Charles was deteriorating visibly. Premature aging set in. The body of a man decades older than his actual age. He grew stooped, gaunt, and hollow-eyed, with the shuffling gait of an elderly invalid. The edema started, fluid pooling in his tissues, his legs swelling. Hematuria, blood in his urine, appeared, suggesting the kidneys were failing. The seizures grew more frequent. Walking became impossible without full support, then impossible altogether. He became bedridden for longer and longer stretches. Reverse engineer his autopsy for a moment. When Charles died on November 1st, 1700, at the age of 38, the physicians who opened his body reported findings so extreme they read like fiction. His body, they said, did not contain a single drop of blood. His heart was the size of a peppercorn. His lungs were corroded. His intestines were rotten and gangrenous. He had a single testicle, black as coal. His head was full of water. Every other documentary quotes those findings for shock value. But ask the question nobody asks. What did those failing organs feel like while he was alive? A heart atrophied to near nothing means chronic cardiac insufficiency, shortness of breath at the slightest exertion, a fatigue so total that lifting your arm feels like lifting a stone, a constant awareness that your heart is not delivering enough blood to keep your body running. Corroded lungs mean chronic respiratory distress, the feeling of breathing through a wet cloth, never getting quite enough air, a tightness in the chest that never relents. Gangrenous intestines mean the chronic gastrointestinal agony that plagued his entire life had, by the end, become something indescribable. Pain, infection, malabsorption so severe that his body was essentially starving while surrounded by food. A head full of water, likely hydrocephalus, means mounting intracranial pressure, headaches beyond the reach of language, visual disturbances, cognitive decline accelerating as the fluid compressed his brain. In his final weeks, Charles was bedridden, swollen with edema, racked by seizures, unable to eat, barely conscious for stretches at a time. The accounts from those last days describe a body shutting down system by system, while the mind, that partially aware, partially comprehending mind, flickered in and out. He died on November 1st, 1700. He was 38 years old. He had the appearance and frailty of an old man. Here's what stays with me. Charles II didn't understand why his body was this way. Nobody told him. Nobody could. He never learned the word gene. He never learned the word chromosome. So they told him he was bewitched. They told him the devil had done this. They performed exorcisms on a man whose suffering had been engineered by his own family, deliberately, strategically, across 10 generations of marriages designed to consolidate power. Philip II married his first cousin. Philip III married his second cousin once removed. Philip IV married his niece. Each marriage tightened the genetic noose. Each marriage made the next Charles more likely. And not one of those people who signed those marriage contracts, who performed those ceremonies, who celebrated those unions with feasts and fireworks, ever had to feel a single moment of what Charles felt every day. His tongue pressing against the roof of his mouth, the ache in his jaw, the chalk-bone legs that couldn't hold him, the seizures that stole his consciousness and left him confused on the floor. The meals he couldn't eat, the words he couldn't make people understand, the treatments that only made it worse, the priests who told him it was his fault, every single day for 38 years. That's not a genealogical curiosity. That's not a meme about a funny-looking jaw. That's a human being. If this hit different than the Habsburg videos you've seen before, subscribe. There are more stories like this one waiting.